Welcome back, and thank you so much for staying with the team as we continue to tell your story. Now, as part of Reproductive Health Awareness Month, the Department of Health has embarked on various educational activities on reproductive health, such as contraceptive use, family planning, and pregnancy awareness. Reproductive health is regarded as an important part of many health systems of any country, as it affects childhood, adolescence, and adulthood development stages. And eventually, of course, that has an impact on the socio-economic status of the country. We look at this matter now with Dr. Thato Chidarikire. She is the director responsible for prevention strategies for HIV and AIDS and STIs at the Department of Health, and she joins me now live in our studios in Johannesburg. Doc, good afternoon to you. Thank you so much for coming through.
Good afternoon. Yes.
Now, let's just talk about the significance of this month. I do know that this week that starts today is Pregnancy Awareness Week as well, and Condom Week.
Yes, so according to our health calendar, the Department of Health has different themes for different calendar months. February in particular is Sexual Reproductive Health Month, where we are basically elevating the need to use or to protect oneself from sexually transmitted infections. So we're talking about STIs, we're talking about HIV as well, as we know is also one of the sexually transmitted infections. We also talk about pregnancy awareness, and this is why within this month, this particular week, today to Friday, actually marks the Condom Week, STI, as well as pregnancy awareness.
But from where you're standing, is the department winning in terms of taking these messages to the relevant individuals?
We keep trying as the Department of Health, and what we are now trying to move out, and obviously we can't work alone as the department. This needs to be a multi-sectoral approach as well, and we also need to get, particularly for young people, into their homes, even to the parents, teachers. Everyone needs to come on board in terms of trying to ensure that especially our young people are actually getting the message, the correct message. And, you know, when you talk about condoms, we talk about correct and consistent condom use. That means that every single time one engages, they need to use a condom. The minute they miss it, there is that window of infection that could be there. So it's important that one tests, for example, because that's the only way one would know that they are infected.
And unwanted pregnancies as well.
And again, unwanted.
Yeah, just last week I was at one of the institutions of higher learning, and I saw a number of young people pregnant. And what actually came to my mind at that particular moment, I remembered plus 15 years ago when I was still in tertiary, that the Department of Health would have activations where they come and talk to the students about issues such as this one, and they would also distribute condoms, for example. So are you still doing such programs?
We are still doing that. You would see that the government has actually amplified the efforts in terms of condoms. We have moved from the choice condom that we used to have about 3 years ago, and we are now distributing Max, the male condom, which comes in different variants. The strawberry, they are also scented. And with the female condom as well, we are now moving from the unbranded female condom to Maxima, which is now the counterpart of Max. All of that, Maxima, basically meaning maximum everything, maximum protection, maximum pleasure, maximum basically everything that one needs to actually consider when they engage. And in terms of higher institutions, for example, looking at what you were talking about, we have the activations that we call First Things First. First things first, meaning let's work on our sexual reproductive health, illnesses, health, and then so that we are able to live healthy, and education then becomes a core. So we have a lot of different activations, particularly this month. We are having in Gauteng, for example, we have 3 TVETs that are actually activating in totality sexual reproductive health and HIV testing services, TB screening, basically health screening. And then we have also in Amajuba, in KZN, we have Mpumalanga, we have different activities.
But I think really the question is, why are young people still falling pregnant in their age at this particular age and time? Because I think the information is there at our disposal easily. So they are on the internet, they are on social media, and we do know that the moment you engage in sexual activities, there's a possibility of pregnancy. So why are they still falling pregnant in large numbers?
We can really just attribute it to behavior, because as you say, in terms of education, the information is out there, accessibility, the commodities are there. We're not just talking about condoms, we talk about dual protection. We have from, again, our SRH part, we have contraceptives, we have the pill, we have the IUCD, we have the Implanon, we have long-term, medium-term, so we do have contraceptives. So believe is not necessarily about the education per se, although we still need to amplify that, because young people come into the system, you know, we get the 12-year-olds becoming 13 and 14. Yeah. So education still needs to be amplified, but behavior is what we need to.
And I think what is even more worrying is research that suggests that the use of condoms amongst the young people has actually declined. You and I having this this conversation really coincidentally. There's an event that happened in Durban and KwaZulu-Natal this morning, a devastating incident really, where a newborn baby was trapped in a stormwater drain. The baby was later rescued by the emergency services, and we don't really have the circumstances as to what happened there. But the question, Doc, is why would a woman carry a child for a full pregnancy term and do that?
And then do that. Again, these are questions that we try to address as we get this information. This was probably an unwanted pregnancy. We can't really assume because we don't have all the details. But if a child is born and then thrown away, it means that there was no plan there. And maybe it was an unwanted pregnancy. That's why this is taking me back to the idea of not just condoms, but contraceptives as well. Yeah. We do have termination of pregnancy as well, which is offered freely in public health facilities. Yeah. We have all the other contraceptives that are there, as I have said, short-term, long-term. So everything is available. I think it's just a matter of young people trying to make sure that they do access them, taking the services out of the clinics as well because of any challenges there, and bringing them into the space that young people
All right. I'm afraid time constraints, but we'll leave it at this. Thank you so much for coming through.
Thank you.
All right. Many thanks there to Dr. Thato Chidarikire. She's the Director responsible for prevention strategies for HIV, AIDS and STIs at the Department of Health. They're talking to us about this week being a Pregnancy Awareness Week and, of course, Condoms Awareness Week.